All right, welcome back. We are having an extra overtime here with Dr. Davis, answering some of the questions we could get to on our live Facebook simulcast on WMLW. So, Dr. Davis, I'm just going to run through a few of these questions that we have right here, if you don't mind.
Yeah, that'd be fine.
One question was, if you have it and have recovered, can you catch it again?
It's maybe a little bit of a two-part question that depends on your original immune response to that infection. Most of the time with viral infections or infections in general like that, you do have some immunity and hopefully will be protected from reinfection. But with this particular coronavirus, it's still not entirely sure that you'll be afforded lifelong protection.
What about pets? How are pets involved in this? Laura wants to know if pets can carry the virus. If you have it, can you give it to your pet, and then can someone catch it from your pet?
Yeah, I'm not a veterinarian, so I can't quite answer that question, although I do know some pets have been diagnosed.
Mm-hmm. Okay, if you have, can you have coronavirus but not have a fever, asked Lori.
You can, and that's been one of the biggest troubles with tracking this disease is that a lot of people, probably the majority of people, are actually asymptomatic and may not know that they have the infection, and that's the risk of us going out into society and coming in contact with others, that we may actually pass that on to somebody else unknowingly.
Greg asked, what is the specific risk for people with diabetes?
I can't say what the specific risk would be. It might matter how well your diabetes is controlled and your age as well, but there would for most patients be a little bit of a higher risk because diabetes, generally speaking, does have some diminished immune response to infections.
Understand if you can't answer this one from Michelle, but she wants to know if there's been an increase in suicides or depression or anxiety because of this?
I don't know about suicides, but it is a concern across the population, anxiety and depression. It's going to be interesting when we look at this whole stay-at-home thing that we've done, how it has impacted the society's mental health. Mm-hmm. Certainly amongst healthcare providers, we're a little bit on edge, so we know that's true.
I think we've gone through all of them, but one thing we did not talk about, perhaps this could have gone in the myths section, but people are constantly asking and saying this is no worse than the flu. Why have we shut down everything? Is it worse than the flu? In what way, and should we maybe have a bigger reaction to the flu?
Good questions. I would say that number one, it is worse than the flu. We know that the mortality rate from the coronavirus, from COVID-19, is greater than the regular influenza. And that being said, I think a lot of people are across our society not quite in tune with how many people actually die every year from the typical flu, tens of thousands, and that's why it's so important to pursue getting the vaccine every year, for number one, protection for oneself, but also the herd immunity, mm-hmm. so that tens of thousands of people don't have to necessarily die. And it's the same thing in my line of work. A lot of what I do, I'm a trauma surgeon, and people don't realize that the most common cause of death between the age of 1 and 45 is injury. So if there's simple preventative measures that we can do better, we can certainly do better as a society of keeping people long and healthy lives.
And the general advice here for coronavirus, aside from shutting down the economy, would also work for flu season. Wash your hands, don't go to work if you're sick, et cetera, et cetera.
Exactly right. It's very basic things that we should probably just be more attentive to as a population. And maybe if there's going to be any silver lining, we're going to be more attentive to the plight of our neighbors and to simple things we can do to help spread disease.
All right, Dr. Davis, thank you once again for going through all of these questions that we had on our live stream and for joining us all morning. We know, again, it is a lot of time, but these are all important questions that a lot of people have.
Great. Again, thank you for having me.